lot of clinical trials research. There's a lot more hope, a lot more cure for patients who are diagnosed early stage or late stage. And on top of that, when I look back into my childhood, looking at my personality, the ability to connect with people, I felt as a physician it's important, but I feel it's all the more important for an oncologist to be able to connect with them at different phases of their treatment. Also, I tried to be with the family, not just with the patient throughout the journey. For example, someone who's older, I want to make sure I have the family on the phone when I'm speaking with them, making a plan, answering their questions from the get-go. To me, personalized treatment just doesn't mean that I'm looking at the tumor type and finding the mutation and finding the right drug or right clinical trial for them. It is treating that person's mindset, treating that person's family, helping them as that person. When I talk to one patient and I talk to a different patient, it's not the same way I discuss things. I have to go to their level and make sure they understand what they're getting into. Give them handouts, explain to them, get them teaching through our staff in our FCS offices. I think that gives them that personalized medicine. I think that's how, as a group, we are different from anyone else in the country or the state, is because we are there throughout their journey, not just in the clinic, not just giving them chemotherapy. Your blood counts are low, I'm there, I know what to do. You have a blood clot, I know what to do. You're going to hospital, I will come and see you there. I am there throughout the journey with any problems you may face. In the clinic, outside the clinic, in the hospital. I think that's a tremendous advantage for all our FCS patients. We won't be able to finish this interview if we talk about all the drugs that's there and how much difference it has made in the lives of our patients. But I could say a 49-year-old with severe shortness of breath in the hospital, we had to put a chest tube in him, so there's tremendous change in quality of life. He was seen in the clinic, I started him on chemotherapy. So one cycle, it was difficult. I mean, we managed all his symptoms well, but it was difficult. He had to miss days of work. And being a young family with kids, priority to maintain your work, maintain your life. So I did lung cancer so we can do certain mutational analysis on the tumor tissue. We sent it out 2 weeks later, I got the results. He has a particular mutation, so he'll be a candidate for a targeted agent. He comes and sees me once a month. He's working, very minimal side effects. I think this is where we prolong life with minimum side effects, maintaining the quality of life. And that's our goal. That's the goal of oncology. And in a lot of tumor types, we have got there, but we have still way to go. I think all our scientific community is definitely working on it. With FCS, we do have several clinical trials. We are working in finding better combinations of this targeted agents, immunotherapy, so which would offer minimal side effects, maintain quality of life while we prolong the life. In a way that when I am doing my work, I definitely don't feel like I'm doing work or a job. It is very challenging, mentally very challenging, but it's very enjoyable. Having that conversation with any type of conversation with the patients, helping them understand, helping them be a part of their decision making and taking them through this journey, I enjoy it, absolutely.